that the Senate should note that Nigeria continues to record increasing cases of medical emergency, including snakebite, scorpion, sting poison, drug overdose, and other form of envenomation, all of which require the immediate administration of specific antidotes and emergency medicines in both public and private school hospitals in order to prevent avoidable death and irreversible health complications. Further note that with grave concern, the tragic and avoidable death of Mrs. Ifunanya Nwangene, who reportedly died following a snake bite in Abuja recently, thereby revealing serious gaps in emergency preparedness and antidote availability within public and private hospitals in Nigeria. Aware that the World Health Organization classifies snakebite envenoming as a neglected tropical disease and underscore the critical importance of timely access to safe and effective antivenoms in public and private hospitals, particularly in countries such as Nigeria, where snakebite incidents remain prevalent. Further aware that Section 17(3) of the Constitution of the Federal Republic of Nigeria, 1999 as amended, mandate the state to ensure the provision of suitable and adequate medical and health facilities for all persons, while Section 14, subsection 2b, affirm that the security and welfare of the people shall be the primary purpose of government obligations, which necessarily extend to regulations, supervision, and standard setting for public and private hospitals. Concern that a significant number of public-private hospitals.
Urge the Federal Ministry of Health and Social Welfare, through relevant agencies and regulatory bodies, to develop and enforce national guidelines prescribing minimum stock levels of essential antidotes and emergency medicines in designated public and private hospitals across Nigeria. Those in support of prayer 1 say aye. Those against say nay. The ayes have it. Prayer 2, urge the Federal Ministry of Health, in collaboration with the National Agency for Food and Drug Administration and Control, NAFDAC, to ensure procurement, quality assurance, proper storage, and nationwide availability of safe, effective, and affordable antivenoms and critical antidotes for use in public and private hospitals, with priority attention to high-risk regions. This is very good. Those in support of prayer 2 say aye. Those against say nay. The ayes have it. Prayer 3, call on the state governments through their ministries of health and hospital management boards to conduct immediate audits of public and private hospitals within their jurisdictions to ascertain compliance with approved antidote stocking and emergency preparedness standards. Those in support of prayer 3 say aye. Those against say nay. The ayes have it. Prayer 4, mandate relevant professional and regulatory bodies to strengthen emergency response standards and require periodic training on the administration. I think this should be undertake periodic training on the administration of antidotes for healthcare personnel working in public and private hospitals. Those in support of prayer 4 as amended say aye. Those against say nay. The ayes have it. The prayer 5 further urge the Federal Capital Territory Administration, FCTA, on all state governments to establish coordinated emergency referral and response systems linking public and private hospitals to ensure timely access to life-saving medicines during emergencies. Those in support of that prayer say aye. Those against say nay. The ayes have it. Prayer 6, call on health regulatory authorities to make the stocking of essential antidotes a mandatory condition for the licensing, registration, and renewal of accreditation of private hospitals, while ensuring adequate budgetary provisions and supply mechanisms for public hospitals. Is there anybody that wants to amend that prayer? Because we don't do budgetary provisions for private hospitals. Those in support of prayer 6 say aye. Those against say nay. The nays have it. Prayer 7, direct the Federal Ministry of Information and the National Orientation Agency to implement nationwide public sensitization campaigns on the importance of prompt hospital presentation following snake bites, other poisoning, and envenomation, and the dangers associated with delayed medical treatment. Those in support say aye. Those against say nay. The ayes have it. Direct the Federal Ministry of Housing and Urban Development to strengthen building regulations under the National Building Code by making non-return vows mandatory in construction to allow weeds to exit while blocking rodents and snakes from entering buildings via drainage systems. Those in support of this final prayer say aye. Those against say nay. The ayes have it. Any additional prayer? I was thinking that the additional prayer should actually include observing a minute silence in honor of this young lady that was bitten by a snake and who died. Very promising young Nigerian with such sonorous voice, and a great loss to the country, a great loss to the family, and I think we should, Senator Shiru, you may wish to craft a prayer of sympathy, condolence to the family, condolence to Nigerians, and 1 minute silence in our honor.
Mr. President and Senator Ashiru, I